letting them know that you see them. The patient feel that they are seen, that they are heard, that they are valued, and that you're not just a patient in this practice, that you're an individual that is valued in this practice.
Hello and welcome to the I Give a Damn podcast. I'm your host, Dr. Joseph Allen, and here we keep you up to date on the hottest topics and trends affecting optometry through discussions with the industry's leaders, masters, and entrepreneurs. Made possible through Fluorescene Media, the same company behind ODs on Facebook. Today our guest is Dr. Sherrol Reynolds, and in our discussion we cover how diabetes is affecting public health and the importance of patient advocacy and access to quality care. I think these are topics that Dr. Reynolds speaks very passionately on and are things that not only optometry but really all healthcare providers should be embracing. One minor note before we get going is I do want to apologize in advance for a subtle change in the audio quality for this episode. With these episodes, we record them live and in person at various meetings throughout the country, and we don't always have control of our environment, and in this episode there was an AC unit that we weren't able to shut off. With the editing of the audio, we tried our best to dumb that down, but just wanted to say that I'm sorry in advance and thank you for being understanding of that. Otherwise, without further ado, please hit those like and subscribe buttons, and here we go with Dr. Sherrol Reynolds. Well, Dr. Reynolds, thank you again so much for joining us here on the podcast. I appreciate you just taking time out of your day. Busy time here at Academy, and it's just an honor to have you here. So thank you.
Thank you so much for having me. It's an honor to be here. I think it's an important podcast, and I'm glad to be a guest and offer some insights into why I became an optometrist and just the profession as a whole. So thank you for having me.
For all of our guests, viewers, I love starting off with just kind of a good question. Probably the question that for a lot of people who we all have unique stories of how we found optometry, how we were introduced to it. So I would love to hear just how did you even decide you wanted to become an optometrist in the first place?
You know, that's an interesting story. So I graduated from high school in the 80s. I know I look 25 to your audience, but I graduated at the time when there was no internet. And also to my story is that I am a child of immigrants. And my parents came here from Jamaica originally, and we migrated to South Florida area. And so I grew up in South Florida, Fort Lauderdale, Florida, went to school, middle, high, elementary in that area. And of course, my family, my parents, when they migrated here, they didn't have degrees, right? So my dad was a construction worker and my mom was a maid. And so again, I went to high school. There was no internet, but I was fortunate to be surrounded by awesome, amazing mentors in high school and got a scholarship to the University of Florida. While I was at the University of Florida, I will tell you, I was going to be a physician. I had all the interest in being a pediatrician. I love working with children, and that was my focus. And I had the opportunity to observe at Shands Hospital in Gainesville, Florida. And I realized at that time that maybe medicine wasn't my calling. And again, you don't have the internet, so what is it that I would like to do? And I knew that I wanted to do something in healthcare. My aunt, who had also migrated to South Florida, had diabetes and became blind from diabetes. And so I was thinking, okay, I'll be the first Black optometrist in the United States. And again, we didn't have internet, so I did not know about the profession. My parents weren't healthcare providers, so I was new at this. So I had to do a lot of going to the library at University of Florida and figuring it out. I didn't even know the requirements. I didn't know that there was an entrance exam called the Optometric Admissions Test or OATS test. I didn't have anyone to speak to, but I remember, in high school, I got my contact lenses from my optometrist at Sears Optical, and I said, you know what, I'm going to just go ask her when I went back home. And I went back home and I asked her and I spoke to her. She went to Southern College of Optometry in Tennessee, and Memphis, Tennessee, and I just asked her, what is this profession called optometry? What is this profession about eyes? Because I had looked it up, and she gave me some insights. And I just personally feel, I don't know if your audience is open to this, but I feel sometimes there's a purpose in our lives and the stars aligned. And there's this new school in Miami, Florida called Southeastern University. How did I find out about that? Well, I researched and I looked into some things and I spoke to some admission counselors. Back in those days, you had to call and to find out. And they told me I had to take this OAT exam. I never studied for it. I didn't take prep courses for it. I took it cold turkey. And maybe I didn't perform as well as I should, but I was fortunate enough to get into Nova Southeastern University. At the time, it wasn't Nova, it was Southeastern. And so I got in, and I wasn't the first Black optometrist in the United States, but there weren't that much diversity in the school. So that's another reason why I become passionate to make sure that we have diversity in this profession, and really that this profession really represents the patient population that we serve. So that's how I became an optometrist, doing a lot of research. And it has been a very rewarding profession for me. How did I stay at Nova Southeast University College of Optometry? I had a great mentor in the late Dr. Terrence Ingraham. He came on board as our Dean of Student Affairs, and he was my biggest cheerleader. And he really felt that representation was needed in academics and academia. And so I applied to be on faculty at Nova Southeastern after doing a residency. And I have been at Nova Southeastern since.
Well,
so that's my journey.
I love that because it does give us a good insight of first for someone like myself when I started looking at optometry, I could just look up online to find okay what schools or optometry exist, what kind of entrance testing or how do I even apply. There was some guidance, right? Because now that I'm thinking about it, I'm like I can't even imagine how I would go about finding where schools are. Now we have, 20-some schools, but
yeah. And more being added.
Yeah, like I have no idea how many schools were around back at that time.
I think at that time, if I can remember, maybe 15, less than 20, I know for sure, schools. And at the time, I applied to 3 schools. I applied to this new school, Southeastern, Southern College of Optometry, and there was a school in Philadelphia called PCO, Philadelphia College of Optometry. It's now known as Salus University. But I applied to those programs, and again, the stars aligned, and I got accepted into Southeastern. I was able to live at home so I could save some money and drive to the campus. My sister ended up going to the law school at Nova Southeastern. And interestingly enough, we both graduated in 1996 because law school is 3 years, optometry is 4 years. So, but it's been a real great blessing. And I look back on that now and I do wonder how I did it without technology, but
Yeah.
Now with technology, you have so much access. You can find the different schools that fit your needs and that you're interested in. But
So you did your residency. Was it primary care? Was it more ocular disease at that time? What was it in?
yeah, so my residency was a focus in primary care. Ocular disease. It wasn't called that at the time, but that was the focus. Back then, when I did my residency, 96, 97, there weren't a lot of residency programs. And I did want to do something different. You wanted to go away, but my mom passed away that year. I graduated 96 and she passed away that year. So I really didn't want to leave home. So I chose to do a residency close to home at Nova, and it was a focus on primary care ocular disease.
I imagine that was probably pretty tough because I remember that year residencies was tough.
It was tough.
So having the emotional challenge of that on top of it, I'm sorry you had to go through that.
Thank you so much for that. It really built me as a person, as a character, my character as a person, in the sense that I know that she is so immensely proud of what I've accomplished and who I've become. And again, as a child of immigrants coming here, your parents want to give you that opportunity so that you can excel, and they didn't have that. Like I said before, my dad was a construction worker and my mom was basically a maid. So the hard work, their tenacity and their determination helped me to become who I am. So I do owe all of who I am to my parents. And, you know, my dad just recently passed, so I want to thank them. I know that they're really looking down on us.
I'm sorry that your father left
Thank
us so
you.
early too.
Thank you.
But you kind of alluded to that you had a family member with diabetes.
And that is really where my passion is. So when people use words to describe me, one of the biggest word is passion. I'm very passionate. And so there are three things, three areas in optometry, eye healthcare that I'm very passionate about. And one of those is making sure that we're giving back. It's so important for me as a minority doctor in this profession to give back. I alluded to it earlier in saying that I really want our profession, the doctors in our profession, to represent our population, our diverse population. So it's important for me to work in the diversity, inclusion, equity, belonging sphere, making sure that happened. And as past president of the National Optometric Association, I was very passionate in making sure we develop programs and continue the legacy of our founders, our visionary founders, the late Dr. C. Clayton Powell and the late Dr. John Howlett, in starting the National Optometric Association to make sure that we minority optometrists have a voice in our profession, and making sure that the schools and the organization are open to and willing to and accept that diversity is very important. And so that's where my big term passionate is. And it's also important for me to be a mentor. I always say this is a term, each one reach one, each one teach one. For me, I didn't, thinking about optometry, I didn't really have a mentor per se. My mom was my biggest cheerleader and mentor. But going off to University of Florida, one of the things that I saw was the individuals that did really well had great mentorship. So it's important to give back. Where much is given, much is required as far as giving back and helping the next generation of young, bright, talented minds become the optometrists like you and I, right? And giving back and representing our diverse population. And then lastly is eye health care. I think it's so important that we take care of our patients from various degrees of background. And what I mean by that is that when you think about a disease like diabetes, disproportionately impacts minority communities. And a lot of times it's just clinically. They have diabetic retinopathy. These new drops are amazing. And they are, and these new injections are amazing. But what's really important is increasing awareness, educating the patients with the disease. There's so many individuals with the disease that are afraid to go get an eye exam, afraid to find out that they have changes in the back of the eyes, that they have bleeding in the back of the eyes. I just had a patient this week, and when we talked about the changes in the back of her eyes, she started to cry. And she's like, this is why I don't go to the eye doctor. I want to change that narrative. I want to make sure that these patients are aware that this disease or the retinopathy that they have from this disease is preventable if they take control of their diabetes, or we could reduce it or slow it down. Right? My aunt went blind not because the doctors didn't treat her. They gave her PRP. Maybe they should have given her PRP earlier, but they gave her PRP, but she still continued to eat and continued the ways that she was doing, and she ended up having a bigger bleed that led to a bigger problem and lost vision in that eye. So increasing awareness about the disease, educating patients about the disease, working, I had the opportunity to be the only optometrist on the 2022 clinical compendium for the American Diabetes Association. And that was really a milestone for me because it's important for us as optometrists. I'm lecturing, and I lectured this morning on hematological disorders and tomorrow the silent killers. And part of the silent killers is talking about diabetes and other vascular disease, but the emphasis is that these disease, you can have proliferative diabetic retinopathy and still see 20/20 and feel good. You can have elevated blood pressure and feel good. We know it's the silent killers. A lot of patients is an eye exam that can detect these diseases. So that's where I have become so passionate. My aunt, yes, but really I think about her condition and if she had known more about it, if she had been so much more educated about it, if she had an ally in her optometrist, in the sense that they took a moment to really talk to her about her disease, would she have gone blind? I don't know. So my whole thing is to make sure that I'm that patient's ally. And how I always talk to my patients is, I'm a partner with you. We're in this partnership together. Together we can slow this disease down. We can reduce your risk of developing loss of vision. We can get you the best care, but it's a partnership. That means you're going to have to come in for your follow-ups. You're going to have to do the tests that I recommend. And once I refer you to the specialist, you have to follow through. And then come back and see me to make sure that you are following through. I will never leave you alone as long as you don't want to leave me alone. So it's a togetherness. We're in this together.
It's definitely a shift. Instead of course, you're not like blaming the patient for their diagnosis, for what's going on, but you're trying to almost empower them.
That's right.
Right, empower them to take advocacy for their own health, to make the changes, but also kind of in that partnership, like we're here to help you, but
we need you to help us help you.
Right.
Yes, exactly.
I also feel that, and I love all that you're doing, and especially the part about just wanting to be a better advocate about the importance of really taking care of the epidemiology, being able to talk with patients, helping them understand, like changing their diet, rather than just saying, hey, this is the treatment you need. Well, no, there's a lot you can do to change your life so that this doesn't, right, more on the preventative care side of things. And I feel like there is a little bit more of a wind of change in that direction in healthcare. Do you feel that way?
I do. I think that what I'm seeing, Medicare had this component called meaningful use, really talking to the patient about preventative care, and you could bill for that if you did that, right? But it's so real, it's so important because we know the longer a patient has the disease, the more risk. But we also know patients who have diabetes for 20 years and don't develop any retinopathy. And, I have this saying, and I said it this morning and I'll say it again. We as optometrists, we're on the front line of seeing the patients. They come into us because they can't read anymore. And sometimes we're the first healthcare provider they see. And we say that as a cliche, but it's so true. So I say to my student, we just don't save sight. We save lives. And I want you to go into that with that attitude. And if you go into your profession with that attitude, that partnership that you have with the patient, the education, the awareness, the importance about preventative care, all those things are really going to make the patient resonate or feel that you're empathetic to their concerns. And hopefully it will make that patient doctor relationship grow stronger, because that's what we really need in this profession. We don't need patients to come in and just give them glasses. Okay, see you back in a year. We really want to get to know our patients. I know we say this all the time, but I'm really an advocate for you as students to learn that being a patient-doctor relationship is so important. I think it's really very important that you develop a rapport and you don't see the patient just as a patient, but as a human being that has human concerns.
I did want to ask, because you've had so many great opportunities and you've experienced and you've been a great leader in our profession on multiple fronts, right? Whether it be on diversity, leadership in the healthcare retina space, and representing optometry in regards to diabetes. But you also had an opportunity working with the National Eye Institute. Is that right?
So I have the opportunity of being part of the planning committee for the National Eye Institute National Eye Health Education Program, or NEHAP. And so I was recently invited to be part of that, and it's been a great experience. And I'm also the chair of one of their recent initiative, Eye Health, My Health. And the aim of that program is to increase awareness about diabetes, hypertension, and just overall eye health in minority populations, specifically African American communities, right? So I've been really fortunate to be the chair of that and work with them on that as well. And I think it's important to make sure that optometrist is represented when we talk about eye health, and especially on that national level with the NEI NEHAP program. And so it's not new for me. I've worked with them in the past. We have had they redid their toolkit for glaucoma, and I had the opportunity to sort of give some thoughts on that redesign of their toolkit. Make sure that the imageries, the talking points really represent those individuals that are disproportionately impacted, those communities, right? So we talk about glaucoma. Yes, you can have an imagery of someone who's Caucasian with glaucoma, but I think we need to have imagery of everyone, because everyone is impacted from glaucoma. So African American, Caucasian patients, our Asian patients, especially with myopia, pathological myopia, our Hispanic patients. So why can't we have all the groups represented so that everyone knows that they're at risk of developing this silent thief of vision, glaucoma? So it's important to do that. So I'm really happy to work with NEHAP and the NEI.
I just think that's an incredible thing that you've done, and you've been able to kind of, again, advocate for our profession and what we do, but also recognizing, giving that guidance, because you can see things from a different perspective.
And that's right. They are, not that the NEI doesn't know this, they probably do. But for me, coming in is just giving the voice to how can we make this more impactful? If we want to increase awareness, how can we make it more impactful? So we could talk about glaucoma all day, every day. But if you really want to hit or impact the individuals, the population of patients that are disproportionately affected by this disease, you got to show me that I'm disproportionately impacted by this disease. One of the things that I said today in my lecture is if a patient see it, they believe it. So, when we talk about wide field imaging and these imaging devices that are new that can help us diagnose early, detect disease early, make changes for patients and refer patients earlier for treatment, therefore we can preserve sight. I think those imageries or these imaging devices are important in the sense that if the patient sees on maybe the wide field imaging or sees on these OCT scan what I'm saying to them, they're going to be more inclined to get the care.
The photo's worth 1,000 words, they say, right?
Yes, it is. I believe it is.
Within our own profession, we can go a couple ways with this, but with our own profession, I know you give a lot of lectures on things like diabetes, because that's a major part of our healthcare crisis, not just here in the U.S., but globally as well.
Yeah, recent data was just published in 2023. 500 million people worldwide will have diabetes by the end of the year.
It's frightening,
I mean,
right?
we got close. Now it's really 500 million people. It's just like the new statistics on diabetes in the U.S. Half of the U.S. population have the disease or are at risk of developing the disease.
And they don't even know it. Right?
They don't even know it.
So I know we spend so much of our time in education, and because you have students that you're educating on this, how we spend so much time learning diabetes and management of diabetic retinopathy. Do you think there's a weakness that optometrists maybe overlook, something that we maybe could spend more time on to improve our patient care in the realm of diabetes?
Not just diabetes. I just think about overall systemic disease. Again, as I mentioned, I say this to the students, we're more than just saving our patients' sight. We can save our patients' lives, right? It's interesting that you brought that up because I recently heard, I was talking to someone from the ADA that I was working with, and we're talking about diabetic retinopathy and how in Europe, the rates of diabetic retinopathy, the prevalence is down. And here in the United States, it just went up. So June 2023, close to 10 million people now have some form of diabetic retinopathy.
Yeah.
That's really staggering, right? Before the NEI had projected 7 million. So we've gone up quite a bit. Why is it that we're seeing more cases of patients with diabetic retinopathy and diabetes? I think as optometrists, any part of the healthcare team, that's really important, that we're all part of the healthcare team, that we communicate with each other a little bit more. I think that it needs to be this bi-directional communication. I think optometrists, I don't know if all of our colleagues are sending reports or referral letters or letters, summary reports back to their treating physician. So if there's one thing I think optometrists could do a little bit better, maybe communicate with the other members of the healthcare team. And, I'm always asked, what is effective communication? Succinct to the point, right? Patient has diabetes, the patient has retinopathy. And even for those that don't have retinopathy, I think that will help sort of build the collaborative effort between the two providers in ensuring that the patient gets a yearly comprehensive dilated eye exam. The other part is, mental health. We talked earlier about mental health off camera, and patients with systemic disease, whether it's diabetes, glaucoma, high blood pressure, when they have these conditions, there's some sort of mental challenge to it, right? Accepting it. I mentioned earlier that my patient cried. I think optometrists, my colleagues, can be a little bit more empathetic and making sure that we recognize that sometimes you're that first person that's hearing that patient. We need to listen to our patients a little bit more and get them the help that they need, refer them for mental health. And then last but not least, these insurance and financial and other barriers, especially for minority communities, these social determinants of health, are really impacting our care for our patients, and I think that I don't want to say universal health care will fix this problem, but if a patient has the disease, I don't know, maybe a slight charge to take optos imaging or wide field imaging so the patient can see their disease. Because remember, we talked about seeing it is believing it. You know, Again, imaging, if the patient has early maculopathy changes, we can refer those patients. Sometimes these insurances they block us from doing what we need to do for the patients. And so I just feel that as optometrists, communicating better, listening to our patient, and maybe if there's some sort of financial assistance that we can offer our patients. I know that we're in a profession, and it is a profession, and we should make money, but a lot of patients who are desperately in need don't have the resources or the income, and some of these insurances are a real barrier to care.
They are, and I don't know anybody who loves insurances except for maybe the higher ups who run the insurance company, right?
That's right.
The what we mentioned about mental health is, I think, a huge part of healthcare in general, and I think it's a huge part of what we do as just as primary eye care providers. There's almost not anybody who doesn't come through my door that has something going on, whether it be anxiety, facing depression, some sort of untold just challenge that they're having in their life, right? And sometimes that can manifest in their eyes, or in their other symptoms, even things like dry eye,
right?
And the functional amblyopia or functional vision loss, those sort of issues.
I mean, think about this too. When you talk about dry eyes, ocular surface, if you're not sleeping well, we're going to talk about sleep and sleep apnea and how it impacts the eyes. But the person doesn't necessarily have to have sleep apnea. The person is just not sleeping well. They're not getting enough sleep, and not getting enough sleep, you can have exposure keratopathy. You can have dry eye symptoms. You can exacerbate and make worse your systemic disease because you're in a perpetual state of cortisol release because you're so stressed. So I think having those conversations with our patients, not when they have the disease. A lot of times when patients come in, they're buzzwords. I'm overworked. I'm just so tired all the time. I don't know, you missed your appointment for the last 5 years. Things have just not been going well at home. Those are maybe those entry points. Are you okay? You can ask the patient, are you okay? Right? Because they're looking for someone to ask. And a lot of times, if you just simply ask, "Are you okay?" If they say no, then there's that moment to sort of offer some help and listening to our patient. I mentioned that before with their disease. Listening is so important, letting them know that you see them. I love Avatar. I see you.
Yeah.
The patient feel that they are seen, that they are heard, that they are valued, and that you're not just a patient in this practice, that you're an individual that is valued in this practice.
And it's really tough, again, because of the way our healthcare system is built, the way
I know.
insurance is stacked up. Doctors of all form are forced to see more and more patients with less time.
I know. And someone asked about how we can address that as healthcare providers, primary eye care providers. And one of the things I brought up was staff support. Sometimes your staff could be your indirect advocate for the patient.
Mm-hmm.
So you may not have the time, but there's someone in the practice that, whether it's the tech that's working up that patient, or if that patient's crying at that moment, if they're trying on lenses and they're getting frustrated because the INR is not going well, that staff can have a moment to talk to that person and empathize and listen, especially high schoolers. We're seeing a lot of mental health challenges across the board, but especially in our younger patients and our younger individuals. And so taking a moment to listen, your optician is indirectly that therapist, right? So this is where we can address it with staff. We don't have to be so cold and clinical and, okay, I'm on to the next person.
Right.
Your staff can be that support. So then they love coming to your practice.
Mm-hmm. And I think that's really wise, because I think a lot of patients, they're intimidated somewhat by the doctor. They know the doctor is really smart and their time is valuable, and they don't want to, as a patient, you don't want to look stupid in front of the doctor either. So your patient may not be sharing as much information directly with you as the provider.
Right.
They may feel more comfortable opening up to your staff member.
That's right.
I know one of my good friends, she loves her dentist office, not because she necessarily loves the dentist, but because she loves the dental assistant.
See, there you go.
Because her dental assistant knows her name, she knows her kids.
Mm-hmm.
They get a chance to just talk for a few minutes, and that's why she loves seeing that dentist's office.
Yeah.
So
same thing. I love my OBGYN practice. I love my doctor, but me and her staff. It's amazing. They remember my name. And you know what they do when I walk in? "Hi, Dr. Reynolds." I was like, "Oh, what?" They remember I'm a doctor as well. It's in the chart. But they call me by that, and they're like, "Do you want water? Do you want anything?" I'm like, "No, I'm good." So I have referred so many people to that practice because I feel like it's very engaging, homely. You feel safe, you feel respected, you feel heard in that practice. I feel like if there's anything that is under, the clinical finding with my mammogram, I would have not only the doctor's support, but her staff to support me. So,
and I think our world right now is maybe fighting some challenges with the sense of community, with the rise of how, I don't want to blame everything on social media, but just the way our culture and world has been driven and changed by access, such easy access to the internet. You don't need to talk to anybody to order food or you don't even need to go shopping. You don't need to interact with a human being to purchase things anymore. You can just order everything on your phone or online.
mm-hmm.
And so even healthcare is kind of becoming, it's like almost being forced to be streamlined that direction. But that certainly breaks down our ability to communicate, to help each other.
Patient-doctor relationship.
Patient-doctor relationship, exactly.
And I think it's really important, the patient-doctor relationship, regardless of all the new technologies that you bring in, the changes in the profession, some of these doctor-less exams, the doctor not being there. That patient-doctor relationship was something that was really taught to me when I was in optometry school, to really treasure, to really honor that and respect that. And even now, almost 30 years later, it's really important for me. And I try to advocate that with the students. So regardless of all the changes that have occurred, and we have new ways to diagnose, new technologies for our patients, we can't lose that doctor-patient relationship.
I kind of picked this up in your voice, and I'd love to just ask your opinion on, because this is still something that people are debating, is this virtual eye exams. Can people not only just get their eye exams done through a phone or an app on their phone or from the computer, or even having like a virtual exam where the doctor's on a computer screen in front of you while somebody else is playing with the dials. If you mind sharing, I'd love to hear your thoughts, concerns, if any.
Well, I think our profession is constantly evolving, and that's a good thing. So that's the first thing I would like to say. When I was in school, we didn't have OCT. So now we have OCT or optical coherence tomography. We have new ways to detect patients' pathology earlier, intervene earlier, and save their sight. One of the things the pandemic has really highlighted is our need as a profession to sort of evolve as well. Patients weren't coming into the practice. We're in a shutdown type of mode. So how can we help our patients? And so, the American Diabetes Association recommends or supports telescreening for patients, especially our patients that have diabetes in rural area can help pick up more disease. Maybe that's why the number is a little bit higher because we introduced telescreening for patients that have diabetes.
Right, maybe we're just capturing more of that
And we're
data.
capturing more of the data. So I agree that our profession needs to evolve, and I think the pandemic sort of highlighted that. We have patients that are older and have health comorbidities that make them more high risk to develop COVID and other infection, and they don't always want to come to the doctor's office, and to be seen. So I advocate for that. But at the same time, I think it's important to, again, remember that doctor-patient relationship. I think in any technological change, so now my kids have phones, and when I was growing up, you could talk to people, like you got on the phone and you spoke. So good thing that we've developed the phone and you could text, but now the text is you're sitting next to the person saying, how are you? As opposed to having that conversation. I don't want to lose that personable part of our profession, that personal relationship is what we call it. With technology, I think that we need it. I just think that having the patient come into the practice, speaking to the patient, engaging with the patient is still something that I'm an advocate for. You will have patients that are going through so much, and you're not capturing that with telehealth, right? A little bit. Sometimes they are not as honest as when they're in the chair with you and you actually see them physically. So I think there's room for a growth, and I think a room to continue what we're doing. So I'm not unopposed, I don't think, but to the evolution of our profession with virtual eye care. I just want to make sure that that doctor-patient relationship is still there.
I think there's definitely a pros and cons to everything,
Yeah.
and technology always has to start somewhere, right?
Yes.
Myself personally, I haven't really thought about the breakdown of the patient-doctor relationship in that regard. So thank you for sharing that, because my other thoughts were always, well, like if I have a student in our clinic, and we've usually got 4 to 6 students, if I have a patient who's got a red eye and they come back to me and I'm like, you didn't stain for fluorescene? Is it a virus? Is it a virus? Is it bacteria? How do you know it's not herpetic? Do they have a
Right.
uveitis? What's their eye pressure? You
Right.
didn't check any of these things? I would fail that student.
Right.
And unfortunately, a lot of these kind of virtual exams, I know just can't, at this time with our technology, and again, it may improve, but at this time, I'm still like, it's not there. Maybe it's getting there soon, but those are some of my concerns. More of the technical side of things.
I agree with you. The pros and cons.
Yeah.
There you go. The pros and cons. Like I said, the pandemic opened the door, because what we recognized during COVID-19, the height of the pandemic, is that virtual healthcare was necessary, needed. Our patients couldn't come into the practice. And so it has evolved. But
the quality versus quantity
that's
debate,
right.
as always.
Yeah.
So, Dr. Reynolds, we've covered a lot of topics, and I know we could talk probably for a few more hours, because you have a lot of insight to share. But one of the questions I do love to ask all of our guests is, if you were elected as kind of this Surgeon General of Optometry to make a change. And if you could snap your fingers, make one wish, whether it was for the profession of optometry or for kind of the well-being for all of our patients, what would be that special project that you would wish to improve our profession?
Access to care.
Access
To care. As I said earlier, these barriers that patients encounter really can impact access to care, and not just care, quality care. If I could just snap my finger, anyone could have access to quality health, quality eye care. And maybe that might impact insurance companies. I don't want to use the word universal health care, but just access to quality health care.
What do you think is the biggest barrier? I don't know the exact answer, if you do, but
I don't know
do you think
the
it is
exact answer either. I think there's always this challenge when you look at universal health care. The pros and cons with that as well. There are some individuals that you don't get the best health care with universal health care. But again, I just saw a study that patients in Europe, specifically England, I think because of their universal health care, don't quote me, but their numbers of cases of diabetic retinopathy has gone down.
Mm-hmm.
We can do that. And I think, the telehealth screening is great. That's access to care for remote patients. But a lot of the barriers to saving sight for our patients is just access. These medications, neuroglaucoma medications, are very expensive, but they're more efficacious than maybe, other medication. And yet, you can't give that patient that medication because the insurance won't cover it, or it's way too expensive for that patient because of their financial barriers. New and awesome treatment for diabetic maculopathy and diabetic retinopathy. We have new medications for AMD, but some patients just cannot afford that, and some insurances just don't want to cover that. If we can just eliminate those barriers, you know how many millions of individuals we can save their sight, save their lives, improve their quality of life, and then it becomes better for the society.
Right.
When I hear people say, well, I don't want to pay for people to get eye care, I get it. I understand. I'm not arguing universal eye care. But at the same time, aren't we paying when they go blind? They need division of blind services.
Yeah.
So in some ways, we're still paying to help these people, and we're not a cold society. We're not a selfish society. I would hope that if someone does lose their vision, that they get help and assistance. We have services for them. So we are in some ways paying that. Why can't we make sure that we can reduce that or prevent that? So access to care and access to quality eye care.
Well, thank you so much, Dr. Reynolds, for being here, being a guest on I Give a Damn. You're somebody who clearly loves our profession and cares about what you do. So thank you very much.
Thank you so much for having me. It was a pleasure to be here.
So that was our episode for today. Thank you so much for tuning in. If you did find value in this episode and like to hear more, make sure to subscribe to us either on YouTube or follow us on wherever you get your podcasts from. Otherwise, I appreciate you guys listening in and hope you have a fantastic